Hi, I'm Chantal Ambrose. I'm a dentist and I host a healthcare business podcast that shares tips straight from the industry leaders. So, whether you are a startup or needing a push in the right direction, a family business, or just looking for some mentorship, join us. Welcome to some of our pioneering episodes of Behind a Smile. Today I have Dr. Pedro Beech, and I'm very excited to have you in. We met when we were talking at Women in Implantology, and it was one of those fascinating and really empowering moments when I met you because I'd never really realized that the percentage of women that are in maxillofacial surgery is that small. And I realized immediately that there's something very special about you, and I am absolutely excited to have you on. I want to share a little bit about what you have to offer. So, you're working at Cape Gate Mediclinic, and you are the only female maxillofacial and oral surgeon in the Western Cape. And, you have a special interest in orthographic surgery, implantology, cleft surgery. You recently now returned from India, and I see that you've participated in a fellowship now for cleft surgery. And I just really want to introduce you as being one of the powerhouses of maxillofacial. So welcome, Dr. Pedro Beech.
Thank you, Chantal. Thank you for having me. It's really an honor for me to be on this platform with you. So, yeah, thank you for the invitation.
So, listen, when I was listening to you when we were speaking together, I remember you calling out a statistic of being within the 14% of female maxillofacial surgeons in SA. Now, tell me a little bit about how did you get to be one of these women and what led you there to be one of these pioneers?
When I was young, I always knew, for as long as I can remember, I wanted to be a dentist. I didn't really know about maxillofacial surgery. So I've been wanting to do dentistry since primary school. And that's kind of what I focused on, and it worked out as planned. And even during my undergrad, I liked oral surgery, but I was never really, dead set on maxillofacial surgery. And you know how it is when you were undergrad student, you want to get your quotas done and you want to get done and get out. But it wasn't in my community service year. I was in Kimberley, and we had a rotation where we had to spend some time with the maxillofacial at Kimberley Hospital at the time. And I tell you, when I watched this man work, I was amazed because it was like artwork. And I think that ignited the flame. And so we were a group of ComServes there, and I begged all my colleagues to say, listen, guys, you don't like maxillofacial. Let me do all your rotations, just so I could spend more time. And this fire, just flamed this fire in me. And I then opted to stay another year and a half or a year and a bit in that department after my community service, knowing that it's a long journey. I wanted to make sure, is it what I want to do? And to get, sometimes when you look at things from the outside, it looks different. And when you're inside, you see a different perspective. So I opted to then stay another year and a bit in Kimberley, worked in the maxillofacial department at Kimberley Hospital. And I tell you, the bug bit. And I knew that's what I want to do. So yeah, from there, I then came back, just worked as a dentist initially in Cape Town, got into the oral surgery department. You kind of didn't realize you need to get involved in academics. So started lecturing, got involved with research, started doing more academic presentations in the department. And that's kind of how you need to upskill yourself as you go along this journey. And you very soon realize that you don't rush this journey. It's not a rush. You got to allow the journey to mold you. And I say that because in 2014, 2015, I went for my first interview. And maxillofacial is very competitive. And I had all my ducks in a row, and I thought I had all my ducks in a row. On paper, I did. But just to give you perspective, we were, I think, 12 candidates, of which 11 was men and myself. And it was for 5 posts. And afterwards, I didn't get in. And you're obviously hard on yourself, and you're asking, why? And looking back now, I'm very thankful that I didn't get in there because I wasn't ready. I might have had my ducks in a row on paper, but I didn't have the necessary clinical skill that I needed at the time. And so then I got in for a developmental post, about 2.5 years. And you could now say, did I delay my life for 2.5 years? No, I didn't, because when I finally got in 2017, my baseline starting as a registrar was just so much better. So yeah, it was a long, tough journey. And then I got in 2017, finished in 2022 at the University of the Western Cape, and a tough 5 years being a registrar. And yeah, now my practice is just over a year old at Cape Gate Mediclinic, and I'm loving it. So long journey, and but good, good. I'm happy. I'm
Well,
happy at the way we are.
congratulations. Super
Yeah,
congratulations. Often when you come to the end, people think that the beginning was quite simple and quite easy. So it's always interesting to me when I listen to everyone's journeys and just the fight that it takes to keep on going with something that you want to do in life. I've heard quite a lot about now being a registrar. You've just finished becoming a dentist. So you sort of have a sense of confidence about yourself. Now tell us a little bit about what do you expect as a registrar? What's that process like? What does your daily life look like, and how does it differ from just your capacity now? You've just come out, you've qualified as a dentist. Now you're in a developmental post. So what sort of changes happen? What do you have to
yeah.
think about that you never knew even existed in this changeover now into going into specialization?
It's actually it's a steep learning curve, because you've got a full-time job and the hours are long. So you're starting ward rounds at 7 in the morning, and you need to be prepared for those ward rounds. And then you're only finishing your day once the clinics and things are done. So that could be anything from 5 o'clock onwards. And if you're on call, you could be even called out at night. And there's no post call where in certain disciplines, if you're on call and you had a rough night, you home the next day, you actually continue work. And besides the workload, you've obviously got to prepare for what's to come. So if it's your theatre time and your theatre week, you've got to prepare for your cases. If you've learned something on that day, you've got to go back and read up about what you've learned that day. Obviously, postgrad is self-study. You've got to study on your own, and your consultants are there to guide you, and prep your examinations. But it's a lot of self-study, so it's a big sacrifice, because you have to work-life balance that you would like to have is not there during reg time. So family time suffers, social life suffers, because you don't have a life. You live for work at that stage.
I want to know, what are the procedures you finding to be the most rewarding at the moment?
Before I speak about specifics, for me, what's rewarding in this is just the full circle. So irrespective of what procedure you're doing, for me, it's about, being blessed to be able to treat someone. And then when your patient is satisfied at the end of the day and you look at your work and you're proud of what you've done, that for me is more important than the actual procedure. But if I had to give specifics, obviously as you mentioned earlier, I enjoy orthognathic surgery. It's something that we get exposed to in our postgrad quite a bit. And yeah, I just love that you pre-op you a certain way and post-op you've got that instant result, and you're making a significant difference in your patient's life. So I really enjoy that. I enjoy traumatology too. Let me say, unfortunately, have quite a lot of trauma in South Africa because of our interpersonal violence, etc. So we get a lot of exposure to traumatology as registrars. So I enjoy that too. I've always had a love cleft. We don't, in our postgraduate situation in University of Western Cape, our exposure is not that much as what I would have loved to be for cleft surgery. I do feel, because of the team in terms of dentist, orthodontist, maxillofacial, plastic surgeon, prosthodontist, and your allied workers, there's such a big team that can make such a difference in these cleft patients, that I feel I want to be part of such a team, because there's so much that I can contribute. When I went to India now, just seeing again the long journey you walk with these cleft patients, from when they are babies, primary work, to secondary work when they are in their pre-teens, in their tweens, to orthognathics in their, late teens. So there's so much to do for them. And I can't wait to be part of such a journey. And now with private practice, gives a little bit of a different exposure for maxillofacials. And we do a bit more oral surgery, but you do quite a bit of implantology. I'm getting a new love for implantology too.
Yes, well, it sounds as though you're one of those women that I think you mentioned almost everything that you do, which means to me that you're really doing your love job. So I want to know, now that you've done a little bit of cleft, there are many of us that you remain unaware of just how involved cleft is from the beginning to the end. So, how many ops does that take now for one single cleft baby to be fixed?
So depends on what your initial diagnosis. Is it just the isolated lip? Is there lip and palate? And also a lot of centers have different protocols in place. But if I can just maybe give a broader idea, you get a surgery as a primary. Surgery would be in your earlier years. So anything from 4 or 5 months to 18 months. In that phase, you can do your primary repair. Then you get something called alveolar bone grafting, which you can do at a later age, like 9, 10. Okay, I'm just giving you little groups. There's obviously there is cases that needs more, and then you also have orthodontics in your teens. Some of them need orthognathics if it's indicated. Some of them need implants if it's indicated at a later age. So there's quite a bit. You obviously get scar revision that can be done. These cases that perhaps if they've had palatal surgery and now they've got velopharyngeal insufficiency, that needs to be addressed. So it's quite a complex journey, and not one is the same. So you almost need to treat them, as individuals as what is needed per case. It's a long journey.
Yeah, well, thank you for sharing that because I think it's often a journey that people don't pay too much of attention to. And I think that we just need more people who are able to solve those problems for our cleft children. So it's
Mm.
just my background in peds. I deal with a lot with some special needs, and you see how it's a zone that just isn't the most go-to place for most practitioners because in addition to being quite specific and each person is different, it is something that requires a lot more time and a passion. And a lot of people would prefer to actually put that into a commercial boat of where they would like their focus to be rather than it. So I really appreciate that. So
Mm.
I want to know, what are the most challenging parts of this job? This is a
I
hardcore job.
think time is
Mm.
one of the challenges. Not so much in private, I must add. I think the harder part is your registrar time, and if you're in government sector, because your calls are much worse there. Your work-life balance suffers a bit more when you're in government sector. But yeah, time I think is a big challenge. I think for any specialty really is that the buck stops with you. So when my colleagues in the area refers to me, they sending to me to let the buck stop with me. And so that responsibility, it can sometimes be challenging, but it's important even as a specialist to know when is your limit and when it's okay not to know everything. That you also then ask a senior colleague. I mean, that's across the board. So I think those would be challenging aspects of it.
Yeah, I was just going to ask you that actually, because I know that the programs are such that you do gain a level of mentorship now when you're starting to go into registrarship. And I want to know now, who are your mentors? Who are the people that are your go-tos? And when the days are challenging and sometimes when you're just seeking inspiration or you're just needing a go-to fix, who are those people around you?
It's quite a few to mention. Again, it's such a long journey that you almost don't want to leave out people along this journey.
Yes.
I mean,
Hmm.
I've got to start with a guy who's ignited my flame. I mean, that would be Walid Sali. He's still in Kimberley in private practice there, but I mean, he's the one that was my first mentor and helped me get my ducks in a row to know how to start this journey. So I've got to give him credit for that. And then during my registrar time, of course, Dr. Gregory Hine and Prof. Sean Morkel, they've molded me into the surgeon I am, into the clinician I am. So they played a pivotal role, an important role in my growth, in my journey. And then there's two other professors that I feel I need to mention in my journey, even though I spent not as much time with them, but the time was significant. And that's Prof. Johan Reiner, who's actually my neighbor, and I still chat to him quite a bit. He's just down the road in private practice. So yeah, and then what's nice, while in private, sometimes private practice can feel a bit lonely because you kind of miss that team dynamic at times. But my fellow colleague at the same hospital can often pick up the phone and call him, Mark. I can speak to Mark Meyer quite often. And then I've got a few friends in the industry that I can chat to, and that's what's nice about it is that you doing this love job together, if I could say that.
Yeah, well, that's fantastic because I think that as we go through dentistry and in the current place that we're in, you'll find that mentorship is becoming more available. Where there used to be a time where mentorship just was available to only a few academics that would get into specialization and a few other people who were just well networked. And so it's nice to know, and it's reassuring to know that there is this growing network and almost a change perspective in attitudes and behaviors that can support the community at large. I'm all for it. I do want to ask you, what is
Mm.
quite a funny question to me is, how now, in this very male dominated industry, how do you maneuver this male dominated industry, and what are your in theater experiences like, and what does gender equality look like now in the sphere of the
Mm.
industry?
I do think gender equality in this specific field is quite multifaceted, and allow me to look at it from different perspectives. Okay. Just to give you a bit more insight. Because often we focus on the men, and that's not it. It shouldn't just be that. But if I may start with like a tongue in cheek comment, just to give you a bit of an idea. I recall in my first week of being a registrar, and I was in the clinics with one of the sessional consultants, and he was trying to teach me something. And he makes a comment saying, now you need to stop being a girl and start being a surgeon. Now, at the time, I didn't have the courage to say anything back. I let it be. But in my mind, I recall the feeling thinking, why is it either a girl or either a surgeon? And I told myself from that day, I will prove that I can be both and be proud of being both. I think moments like that is quite few and far between. In my journey, it's been few and far between. But when you look at this gender equality, let's look at it from society perspective. If you in the clinics and you walk into a cubicle with a patient there, and there's been many episodes I've walked in with a male dental student, I had no clue of what's happening. But the patient would immediately focus onto that male and think he's the doctor. And that's a societal problem. And so that's also where this gender equality is flawed, unfortunately, even in today's. Another aspect, obviously, from a clinical or theatre perspective, I must say I've been, let me call it blessed in the fact that even in my role as developmental post, as a junior registrar, or even as a senior registrar, I've only had men around me. And they've never made me feel inferior from my clinical perspective. I've never felt that from anyone, from my peers. And I think you do grow thick skin, so you probably don't allow it either. But I think of all these facets, for me, the most important part that will change gender equality is us as females and how we perceive ourselves. Because often we think we are less, or we think we are inferior, or we feel intimidated. And even though the males didn't intend to intimidate us, we automatically look at it that way. And that's something, a narrative that we need to change. And let me give you an example of that. We were in a ward round, and often we've got dental students that come for co-assistants, and they come and participate in the ward round. So now obviously we're standing around a bed. It's all these guys and myself, and the prof is now asking questions. And we're done with the ward. And as we're walking back to the clinics, one of the younger ladies that's also aspiring to do maxillofacial surgery, she comes to me and she says, how do I do it? How do you do it? How do you not feel intimidated by the guy? And I said, why should I be? What did they do to make me feel intimidated? We all stood around the same bed. We all got asked the same questions. They said nothing towards me. It's my mindset that should change. And for me, it was alarming that in this time, we as women perceive ourselves that way. So I think often this equality can be changed if we change the narrative and we have confidence and we equip ourselves. And it's important. And I want to emphasize this. When we go for interviews across the board, not just maxillofacial, as women, we shouldn't ride on the woman wave. We shouldn't want to get the job because we're the only women female in the interview and we're sitting with a lot of men. We should get the job because we are competent and we are qualified and we are women. It's got nothing to do with that. And so if we change that narrative, I think we'll get the respect we deserve.
Yeah, that's a very powerful perspective. So I do think that the narrative has to change. And I think in society, we are seeing the change. It's a very sad thing to me that there is still such a lot of discrimination across the board on different levels of being able to do the career, because the career often should be based on just the skill set rather than what we look like or who we are or where we come from or any of those things. Yeah, it's a very powerful paradigm shift that we are in right now. So I appreciate that. Listen, you know that my background has a lot of ethics related advice. And I often get people ask me about referrals. And we'll be very honest with you that as a general practitioner, we give the referral hoping without doubt that the maxillofacial is going to just save us from whatever it was that did not go right in that surgery.
Yeah.
And you're
True.
hoping never to see it again. And for the most part, what has happened with this, I find over the years, is that people don't stay in communication. And the referrals become almost fluffy, where it's you're basing the referral on really trying to get somebody out of your office, make it somebody else's problem. But there's no learning that comes from it, where two professionals are working together to get something sorted out. And often that ends up, unfortunately, in a litigation process. So I want to know, as a maxillofacial, as a person that's so experienced and skilled, as a pioneer in the industry, what do you want to receive as a referral letter? What does that look like ideally?
Yeah, so I must tell you, I like what you're saying in terms of sometimes the referrals are fluffy. And I understand is obviously also a thing because we often have so many patients booked and you got to get done. And like you say, you want to get the patient out, but you also don't want to get in trouble or offend the patient or make the patient feel like you want to get rid of them. So I agree. I understand the dynamic, but communication is key. And if it is something that can wait, I do appreciate a detailed email. If it's something urgent, I even make time for an urgent phone call. So if I had cases where my referral base perhaps called my rooms and then my secretary would say, do you have a moment to just help? And if I can't at that moment, I call back. I am always up for having that conversation and helping where I can, because to me, it's about upskilling. And because if you face that same thing tomorrow, you know how to deal with it in a better way. So, and I also, where I can, on my referral form, I try to keep it quite simple. There's different aspects where you can tick a box to what are you sending for, i.e. oral surgery, i.e. implantology, orthognathics, whatever the case may be, you tick on there. And you also have a tick to say, would you like to get feedback? And how do you want that feedback? Because sometimes, yes, you run of your mold, third molar extractions, you might not want feedback. But if it's something specific and you're interested and you want to convert with me, I'm very happy to do so. Whether it be a report back via email or whether it be let's chat about it. And for me, that's important because it's about upskilling one another and giving a better service to our patients.
Guy, I think that if we can all as a, just as an industry at large, think about each other in that way, we all can be uplifted. So I do agree with that. I want to ask you a question that often comes up in just group discussion. And I ask almost every specialist we have on. We go into theater. Do
Okay.
you have any sort of routines of how you go about choosing your anesthetist and how you communicate to your anesthetist so that collaboration can happen in theater? Because I'm imagining a large part of your day is in theater. Can you give us a few tips of how to get that going and to sustain also what we're talking about? This almost a network of education from the people you're choosing to participate as team management.
So my dynamic is slightly different because I've got fixed theatre time and fixed theatre lists. You have the same people that's doing your list, for you. How did I get to choose them? They often approach you. So once you go to private practice, you get group practices, a group anesthetist that's either allied to your hospital or in the area. And you sit down and have a chat first to just see if you connect from a personality perspective. So because I've got so much theatre time, I wanted to stay in a group practice because if someone's on leave, there's someone
Yeah.
to back them up. And that makes it easier from a admin perspective to have things arranged. But it's nice to also realize that you need to get on. You need to understand one another. You need to have that comfort level to be able to speak openly. Because if you've got cases where you are uncertain of certain things or you have a question, you should feel comfortable to ask your anesthetist, listen, what do you think of this? And if I have such a case, a few days before, if even after consultation, I'll say, listen, I'm booking this patient on that day. You are doing the list with me. This is my thoughts. What do you think? And we discuss it so that we prepared, theatre day. And that's important. You need to find someone that, like I say, you get along with, you can communicate openly with. Yeah, once you've got that, it works well.
Yeah, we talk a lot about a lot of trends that are carrying on at the moment for dentistry. So I've read a lot about this whole aspect of patients demanding weight loss treatment plans from this wiring of their jaws and things like that. I thought I just would love to hear your expert view.
I must tell you, I'm thankful I've never got that request as yet. Never do, because it's definitely a no-no in my book. If I wanted to be part of someone's weight loss journey, I would have chosen a different profession.
Hmm.
I'm obviously, it's about patient health. When you're on this weight loss journey, there's no quick fixes. So if someone is looking for a quick fix like IMF or jaw wiring, it's certainly a no-no in every level, because as soon as you release that wires, they'll just fall back into their old ways and you'll just pick up whatever you've lost. And besides that, your oral health is going to suffer in that period of time. And weight loss is not just about what you're putting in your mouth. It's a journey mentally, emotionally. And so on every level, no, 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 no. No wiring for weight loss. That's not the way to go. It's not the answer. I wouldn't even entertain that.
I think that it's a sobering perspective. These quick fixes, and you just you become really aware that there's a desperation to do something very quickly, and I find that we see that a lot in from a general perspective. We see it a lot in moms that seek theater as a quick fix to getting rid of habits and not great habits, I must admit, and behaviors, because
Yeah.
the long term is harder than just the immediate fix. So I think that it is a red bell all the way round. So you've been traveling a lot, and can you give us an idea now of what is Max Becker abroad like, and what are your ideas about whether South Africa is keeping up with the industry standards, and where does MaxVac fit in South Africa as compared to other countries that you've now been able to visit?
I think challenge that MaxVac faces worldwide is that we're not standardized in the sense of what's your requirement to become a maxillofacial surgeon. Because some areas you can just be singly qualified as just a dentist, or you need to be dual qualified, dentistry and medicine, and then only do maxillofacial surgery. So that on its own poses quite a challenge in the worldwide perspective. Because in other countries, for example, if you're only singly qualified, you're going to do a shortened course and you'll be an oral surgeon. Yet when we're sitting in congresses together, we're coming from different backgrounds, different qualifications, doing different things. So that in itself is a challenge. And I wish that one day maxillofacial surgery in the worldwide context could come to a conclusion and say, let's create this path. So we're all kind of on the equal playing field. But I think that's an ideal world. Coming from, especially now spending time in India, obviously very similar type of circumstances, poverty and patient profiles, very similar. But I must tell you, again, I can only speak on a South African context. I can speak from a University of Western Cape context, because that's where because even within South Africa itself, we've got 4 institutions that trains maxillofacial surgeons, and all of us have differences too. We've all got our strengths and we've got our differences. And like my prof used to say, it's always important to be a good generalist. And once you're a good generalist from a start, you can then focus on something specific if you have a desire to do so. What's concerning me a bit, or let me first speak about a positive. A positive in South African context is we've got a lot of exposure to trauma, to pathology, cervicofacial sepsis. We shouldn't sell ourselves short, because what we do here and what we see here is amazing. And the mentors we have teaching us these things are really good. And I do think that we are up with world standards in that regard. Something like trauma, I think the first world can come here and come and learn, because the volumes we see is quite a lot. So from that perspective, it's a big positive for us. I think that what we're producing in South Africa is great work. What I am concerned about is when we're shifting from government to private practice, our scope of practice becomes a bit narrower, because you don't see the volumes of pathology, you don't see the volumes of trauma, and you end up seeing a bit more from an oral surgery perspective and implantologists, and you're getting, it's a lot of overlapping. If I example with cleft surgery, In the Western Cape, it's mostly run by plastic surgeons. In the Pretoria setting, it's mostly done by maxillofacial surgeons. So again, depending on where you are, ENT has a lot of overlapping with maxillofacial surgery. And from a dental perspective, us and periodontists have a lot of overlapping. So I feel from our future as maxillofacial surgeons, we as the new generation, we should focus on not narrowing our field of expertise. We need to keep on growing, keep on, be a generalist, and then each of us should focus on something so we can keep on growing, keep on inspiring, for sure.
Are there any new tech savvy sort of ways to do Max Fact that you've seen abroad that we haven't really touched base with here? What's our technological and digital footprint looking like in SA in terms of surgery?
So we also up there with the first world countries for sure. I think in terms of patient specific implants, in terms of scopes, the problem here is obviously always finance. So
Mm.
yes, even in our training, you get some exposure to it. I mean, you can get patient specific implants in terms of joint replacements. You're getting patient specific implants in reconstruction. There's lots that's being taught. Our limitation is on funding, unfortunately. So we are up there with the first world. We just don't have the resources to follow through. Another example, I'm hoping that my hospital can get a scope. I've had colleagues in the area that's gone for abroad for training to do scopes of the joint. It's not something that's perhaps taught as a postgrad, but again, because that's something niche, it's available here. We just need to then go abroad to get the training, but it's certainly, we're definitely up there with the first world.
Well, that's really reassuring. I appreciate that. Now, I want to talk about the fact that you're a mum and you have this very high powered job and you're doing this amazing work amongst some of our, I think, most amazing male counterparts as well. And how do you keep all of this balance going now? What are these? Can you give anybody some advice on how do you get it all going for you?
Well, balance is important and a good support system. I don't think if I didn't have such a wonderful husband supporting me and cheering me on, it would be challenging without that. And obviously I've got, the old saying of a village that raises your child. I've got a village behind me, and that makes the world of difference. But I must tell you, I make a point of trying to maintain a balance. So I love my work. I love what I'm doing, but it's not my life. So when I'm at work, I do my best. I love it. But when I go home, I also love it. I love being a mom. And I need to also show my girl how to be, if I may use the word superwoman. And, to kind of, that she can also see that, don't let society limit what you can do. So even as a wife, I think it's important that we need to focus on that role, but acknowledge that you also need that supportive husband. And that's not always easy to find, unfortunately. Often get women that's in a successful situation that might not find a partner that accepts that. I'm just blessed that I do have that. And which helps, it makes my balance so much easier. I must add another balance that I have is I love the outdoors and I love mountain biking. So you also need to do me time. To kind of keep it together, you need to realize that me time is so valuable so that you can have mental health when you're doing your other roles. So I do a lot of, at least once a week, I go out and do some cycling. And when you come back from that cycling, you feel on top of the world and you're ready to tackle the next challenge. So yeah, balance is important.
Yeah, I think that we've had so many amazing people on, and we're speaking about mental health, particularly from the idea of women doing more. And remember, we come from a background where these are only new ideas. And we're still growing with getting women in the bigger roles, only
Yeah.
because we had just these five basic roles at one stage. And nothing more was needed, and nothing more was expected, and nothing more was given as an opportunity. And then
Yeah.
as that grew, we find that now we do have women that suffer burnout, and we do
Mhm.
have women that have mental health sort of challenges because now our roles are still, we haven't given away the roles of being great mothers, and we
Yes.
haven't given away the roles of being great wives. or of being alive in your faith, or,
Yes.
giving some time to yourself. We don't sort of move it over. It's almost like we're working at the 200 and 300 and 400% rather
Yes.
than just the 100%. And so what that has often happened, if you don't sort of take a little bit of perspective and step back, is that it has reached that point of burnout.
It's not always sunshine and roses. So I also want to emphasize that it's also okay not to be okay, but that you need to almost listen to yourself. So if, like you say, we're trying to fulfill all these roles and we're doing our best, but you can't do your best all the time. So listen to yourself. And if at times you do feel, perhaps I am a bit burnt out, take a step back, scale down on something. And then once you've, recuperated a bit, you tackle it again. But it's okay not to be okay all the time.
Yeah, I think it's just the recognition that you're not okay that is the struggle at the moment. So I want to know, what is your go-to stress reliever?
On a daily basis.
Yeah.
If I could cycle every day, I would.
Hmm.
By the time, I would probably do cycling as a stress reliever because it's absolutely amazing. For me, certainly prayer. I'm Christian and I love to be, focused on my relationship with Christ. So for me, that, whatever your faith base is, whether it is meditation, whether it is prayer, whether it is just time for reading your Holy Scripture, for me, that's important to tap into that. So that would be my daily thing.
What's the music playing on your playlist at the moment? What do you sometimes in theater you ask the sisters, don't you have that on the playlist?
I must tell you, I'm a bit of a boring soul. I do talk radio.
So, what are you most proud of?
I'm most proud of that whatever I've dreamt of thus far, I've achieved. I've set out a goal. And even if I didn't succeed first time round, kept going, kept my goal in mind. And I've worked very hard to get here. It wasn't an easy journey handed to me. So I'm very proud of that I can say I'm a maxillofacial surgeon because I've put in the hard work. And to me, it's important that I think I've mentioned it earlier. It's not a rush. Because often I find undergrad, once they finish, they want to, okay, what do I do to get in? And they want to tick these boxes and they want to get in and they want to get done. And that's not it. It's not going to make you great. You need to allow this journey to mold you. And so for me, when I look back and I look forward, I'm looking forward to see how my journey is going to mold me. So that's what prides me. I'm also a proud mom. I love being a girl mom. And I look forward to how I can inspire my girl. She's still very small. She's only 3.5. But I look forward to see how I'm going to develop as a mom and how am I going to develop my girl to be her full potential. Yeah, and I'm also a proud wife. I think earlier you asked me also what I do daily to kind of just keep it together. And for me, communication is key in marriage. So when I get home, I give my husband the ear, how was your day? And vice versa. Because often we can, in the hustle and bustle of daily life, we miss and live past each other so quickly. It's important that whoever your person is, that you become, present in their presence. You reflect and you talk and you listen. Yeah.
Well, thank you for that. I think that you've ended on an amazing and inspiring note. Congratulations on your journey. Just keep on doing what you're doing. I think that for every surgery that you do and for every person that you see, that there is a level of inspiration about you that is beyond just what you do and who you are. And we really appreciate it. So thank you very much.
Thank you, Chantal. Thank you for the opportunity.
I've covered starting up and how to turn your vision into a business. And in our future episodes, we look at leadership, we look at multi-practice success. Now, I'm grateful for you, and I would love to hear your ideas. What questions do you need answered? Please drop me a mail at behindasmile2@gmail.com. I look forward to hearing from you, and remember, you are heard, you are seen, and on this platform, you are invited. Let's make it happen together.